use a microphone. Can y'all hear me? Yeah. Is this thing on? You know, the best spontaneous remarks are written down. And so I have written down just a few things because this is too important for you not to hear some very, very basic facts about what's going on. I'd like to start, though, by thanking our panelists for volunteering to share their experiences, their memories, the knowledge, and the words of wisdom that they are bringing tonight, and their willingness to share highly personal stories, painful stories. This is a gift. This is a gift. Mr. Carruthers and members of the panel, we can't thank you enough for being here tonight. We respect what you do, we are deeply appreciative, and we pledge to remember your words. Become better educated, more sensitive, and more dedicated health professionals to the people that we serve. That's what we're here for tonight. Become better at what we do and to serve these very important people. A few facts and things that I think are very important as we frame this. According to the CDC in 2014, more than 1,200 people in Georgia died of an overdose. In 2015, nationally, there were 33,000 deaths, more than any year on record, and nearly half of these were from a prescription opioid. In testimony that was given by Dr. Nora Volkow in 2015 to the Senate Caucus on International Narcotics Control, worldwide there are between 26.4 and 36 million abusers worldwide, and at least 2.1 million Americans who are addicted to prescription narcotics. She postulates three reasons for this. First, the increase in the number of prescriptions written and dispensed. Second, the greater social acceptance of all medications. And finally, very aggressive pharmaceutical marketing. You know how happy all those people with the TV ads, right? They take the medicine, and after they take it, they are happy and their lives are better, everything is just perfect. And the impression that we're getting is that these medicines will make us whole, that they will restore or give us something better than we were before. Listen to the warnings that are quickly and quietly scrolled or spoken while the commercial is playing. And then look up that medicine on the FDA website. Many of them come with what is called a black box warning, which is the highest level of warning and concern by the Food and Drug Administration. And viewers will not know that. They probably won't go and look that up. But when their reality falls short of their expectations, the results are disappointment, depression, and continued pain, both emotionally and physically. So exactly what are opioids? They include heroin, morphine, and prescription pain medications. And they work by reducing the perception of pain and producing a sense of well-being. As a favorite patient of mine once said, and I'm a physical therapist, so I see a lot of patients both in the trauma center and also in my life I've done a lot of pain rehab. It still hurts, but I don't care. That's the effect that these medications have. They work by attaching to specific proteins that are receptors on the nerve cells in the brain, spinal cord, GI tract, and other organ systems. But by doing this, they inhibit the natural painkillers and block them out. So the endogenous endorphins, which is something you probably have heard of, endorphins and enkephalins, which are the natural opioids, over time are not able to do their job. The body starts to produce less of them, and the dependence begins. Now these patients see externally what nature has now been robbed. If the prescription runs out and these people are still in pain, where do they go? The streets. And the rise in synthetic street drugs is just enormous. Synthetic marijuana, cathinones, commonly known as bath salts, fentanyl, the most potent painkiller we have. It is a prescription medicine. It is 50 times more potent than heroin and up to 100 times more potent than morphine. It's available, unfortunately, fairly readily and can frequently fly under the radar of narcotics control because a good street chemist can alter one carbon chain and get it off the list where the FDA has it regulated. And until those legal entities can catch up to it, this drug can go wild. Fentanyl and derivatives are highly toxic, both if you touch and they inhale, putting first responders and our law enforcement officers at risk. If they touch it, if they inhale it, they too get a dose of fentanyl, and that can be fatal. So far this year, in 2017, the new dangerous synthetic opioids have been implicated in Georgia alone of over 50 overdoses and at least 6 deaths. And this is just September. We're not done. So I think you can see how easily the opioid and substance abuse issue has spiraled out of control, and it touches us all. As healthcare professionals, we must be the leaders in fighting this epidemic. For people currently affected, and for the generation of young people who are too easily drawn into the harm. So, Mr. Carruthers, I turn the podium over to you. And again,
Skip it.
A word from our sponsor.
Oh, not very good on microphone. But we'll see. Hi, my name is Lindsay Ark. I am the president of the IHI chapter, Armstrong. We kind of put this thing together for you guys, and this is Tolu, my vice president, or really co-president. She's just there with me. We just want to take this moment to remind you guys about IHI. It is the Institute for Healthcare Improvement, and that's what's putting on this. You think about the title of this event, it's patient, engaging the patient. So it's very easy for us as healthcare employees, as nurses, PTs, administrators, to look at a predicament in a patient from the point we were taught. It's very easy for me as an administrator to look at the numbers or the paperwork or something like that. And it's very easy for a nurse to look at how many times the patient has been in a healthcare environment in their hospital. But with learning the stories from patients and from people who have lived through this, it kind of gives you a well-rounded view of everything. So you're not necessarily looking at, well, this person has cost this hospital this much money, or I've seen this person 5 times this month. You're looking at from a whole point of view, because you can't fix a problem. You can't improve a problem by looking at it at one point of view. So we're hoping by seeing from what you've taught as well as what other people have taught you, and then from the patient aspect, kind of rounding out your view and looking at the picture as a whole and not just as a problem, looking maybe why this patient keeps coming in or what we can do to help them or prevent them from coming in, not just fixing their problem as we come in. And then hopefully this takes it and you become better healthcare providers and better healthcare administrators throughout the project. So we're here to help you at any point in time if you need us. We're here, and I'm Lindsay, this is Tolu. Tolu's going to say some stuff.
Thanks.
Hi everybody, I'm here to say some stuff. My name is Tolu Abedadokun, and I'm the Vice President. I know, one name. I want to first and foremost thank you guys for coming. We appreciate you taking the time out of your day to come to this program and hopefully learn and give something and take something back in return. And we're really excited after, we didn't know who was going to speak, but then after getting a chance to talk to Bill, we were like, you're coming. There's no other choice. So we're really excited to have you guys here today, and we appreciate you guys for coming. So a couple of house rules before we begin. On your seat, there is a paper, and it's a survey that we want all of you guys to fill out. For students who have come for a class, this will be your verification that you came. So at the end, please feel free to turn it into our volunteers, our lovely volunteers, at the door on your way out. Also, I do advise that you turn off or silence your phone just out of respect for our speakers. If you guys don't know how tonight's gonna work, we're gonna have Bill come up here and speak. And then afterwards, we're gonna do a breakout session. And each one of the columns of seats represents a different person speaking. So we're so thankful to have them here tonight. So I'm going to give it back to Lindsay so she can kind of introduce you to our next speaker and we can move along. Thank you.
Thank you.
So when we spoke to Bill, he said that he wanted to be introduced by Jeff, and apparently he is the controller of the universe, and this is the reason why. So we're going to bring up Jeff with a G, not a J, and he's going to introduce Bill for you guys.